quite a lot of people ask me this question: why would I go for an online program? And I found some answers, because I've seen businessmen, for instance, who are disciplined to do daily something, but they don't know when, because the business schedule, the clients don't allow them to do at a certain point, and that makes it easier for them. That's one of the observations that I made.
Also, it's also a question of a personality style. Some people like to confide in someone else. They like to talk to someone else and get advice from someone else. And people like that probably will benefit a lot from a face-to-face psychotherapy. But there are also people who want to take their life into their own hands. And who say, I want to achieve this, only I need some advice on how to achieve this.
Some guidance.
I need some guidance on how to achieve this.
It's like a compass and a map, and I will go my journey.
That's right.
Something like
That's
that.
right. And each day, it's like a compass and a map, and we are on this road of our life, and every day there's some fork to take, so if every day you have this small input, then there's more chances that you stay on the right way, than if the input comes only with an appointment every 2 weeks or every 3 weeks even.
Yeah, so actually, if I try to summarize that, what you were saying is that personality style, that some people rather like to have a talk, while other people rather need a guidance or a map, and some people prefer to be more self-driven, and the others take it from the empathic relationship.
Absolutely.
That might be a difference why one has an inclination to an online program and another to a live relationship.
And probably both will profit as well from an online program as from a face-to-face psychotherapy, but one will be more inclined to choose the one than the other, but both will profit in both cases, I think.
Yeah, that's true. So you could even combine both if you want.
Absolutely.
Okay. Another topic that I was thinking about is what I saw when people come online for the program, but happens quite a lot, that people seem to be quite confused about what's the difference between stress and depression and anxiety, and quite often we see in real psychotherapy practice that there is a mixture of both.
In most cases there's a mixture of anxiety and depression are very closely related, also neurophysiologically, and what happens in the brain when in anxiety and in depression is very closely related.
Yeah, it's like similar areas of the brain and similar biological mechanisms that are happening.
Absolutely, and also it's the same drugs that we use for treating anxiety as for treating depression, and in a large measure it's the same drugs that are used because the processes in the brain are so similar.
Would this explain, I remember that some years ago you told me about your research that you did in the hospital on, actually it was on alcohol addiction.
Yes.
And one of the things that was quite remarkable when you told me is that you told that when after several years you do a follow-up study, that those people who say that they got success with the treatment, that most of them also say that other problems than the main problem for what they came, like anxiety or depression and others, also got solved, also if they did not directly work on it. That's
absolutely. That was a very interesting finding, that when we treated people for the alcohol problems and they solved these alcohol problems, if our programs, I must say, are very, very brief. People, if they are hospitalized, they are hospitalized for 3 weeks, or if we see them on an ambulatory basis, if they come to the hospital to speak with the doctor or with the psychotherapist or whatever. The number of sessions is also quite low. It's not more than 5 sessions in general. So there is no time to speak a lot about their depressed state or their anxiety or whatever, which most people with alcohol problems also have. So there's no time to treat these problems too. And what we found, and that was extremely interesting, is that when they solved their alcohol problem, they they afterwards they showed that they also could solve their other problems on their own. Yeah.
Yeah.
Once they have started solving their problems, they don't need anybody else. They don't need to come back for another bout of therapy with a therapist. They can't solve it on their own.
Would you say that this is like they learn to solve problems? Something like that?
Absolutely,
Okay.
yeah.
And
this is something that a program like this can do. Yeah.
because on one side they learn to solve problems, and then my question would be, how would you explain then that they are building these habits in such a way that they will not relapse?
Yeah, that's a very interesting question too. Yeah, that question about habit formation. Well, to put it very briefly now, we can discuss it at another point. We can discuss it a little more. But to put it very briefly, what happens is that when whatever we do, when we do it repeatedly, one can say that's a habit. Yeah.
Yeah.
So we get
sequence
into,
of in time you repeat the same. Yeah. Okay.
Then it's a habit. Yeah. It becomes a habit.
Yeah.
So we can get into the habit of having anxiety attacks, for instance, when some situation presents itself. Yeah. Or we can get into the habit of being depressed when there are too many problems facing us or whatever. Yeah. So you can say that that whatever we do, when we do it repeatedly, it becomes a habit.
So you mean that even disconnected from the origin why we started to have anxiety the first time or depression the first time, it can become a habit, and treatment or self-help should rather focus on breaking the old habit and establishing the new one rather than looking for the origin.
Establishing a new habit instead of the old habit.
Yeah.
And that's something that occurs in the brain. Yeah, when we make a new habit, to put that very briefly, when we make a new habit, there are new connections that are made in the brain. Yeah, and these connections need to be repeated. That's again why a program like this is so interesting. Yeah, because each time you repeat the new habit, it becomes better established in the brain. So if you repeat it very often, every day for instance, it becomes it's much easier to establish it in the brain. Yeah, and then when this new habit is made, then the old habit is still available, but the new habit comes in instead of the new instead of the old habit. Yeah, and it's just a question of choosing. Then, do I want to be depressed, or do I want to go through my life as I wish to go through it? I would want to.
Oh, it's like you have a switch and you can choose.
Absolutely.
It maybe still takes some effort, but you can do it. Is
Absolutely.
that what you?
Absolutely.
Yeah, that's what you.
And after sometimes it doesn't even take any effort anymore because the switch stays in the right position. Yeah.